Hi, and thank you for joining us. I'm Dr. Michael Richie at the Richie Eye Clinic, and I'm joined today by Dr. Bruce Gustafson. Dr. Gustafson is one of our optometrists at the Richie Eye Clinic. Bruce has been in practice in Faribault for over 25 years. He brings with him a vast wealth of experience and knowledge. As you know, Bruce, it's now August. Everybody starts thinking about getting ready for school. If I'm a parent, what should I be thinking about as far as back to school for my children's eye care?
Yeah. Well, I think, it's amazing how quick summer goes sometimes, and time just gets away from us. But, when we hit August, we think a kid's going back to school. It's a good time to make sure that, the kids' eyes are ready to start doing all the reading and stuff they do in school. So it's a good time to just think about coming in to have the eyes checked. What we're going to do in those exams, we're going to make sure they're seeing properly. We're also going to make sure that, they can use their two eyes together so they can function. They can focus from their books, back to the board, back to their books, and so on. And so it's just a good time to get that out of the way, and then they're ready for school.
Now, as we look at back to school, we have a lot of kids, the younger kids, of course, most of them wear glasses, but some of the older kids are starting to transition into contact lenses. What sort of options do we have for families with kids in glasses, or for those kids that are trying to assimilate into contact lenses?
Yeah, we have a great kids package. We have two packages that includes anti-reflective coating. They have warranties on them, and as you know, anytime with kids, the glasses are going to get abused a little bit, so we have good warranties on them. If they're involved in any kind of athletics or just kind of want to get rid of the glasses, we have so many options as far as contacts go. And so contacts are also a great option to look at too.
Now, one of the questions that parents always ask, when is my child ready for contact lenses? What do you typically tell them?
I'll give you a good example. All of my kids have worn contacts, and I think they all got them around the age of 9, 10 at the latest. And so with the kind of contacts we have today, we have contacts, for example, one-day lenses, which require, for the most part, no care. You put them in the morning, you throw them away at the end of the day. So it's a great way for kids. You don't have to be concerned as far as are they cleaning the lens and so on, but we can pretty much custom make any prescription in a contact lens today.
Now, one of the other tools that I typically tell parents is this is a good time to judge the maturity of your children. Take advantage of this as a parent and say, look, you need to prove to me that you're mature enough to handle these contact lenses. Here are some jobs that I'm going to need you to do on a regular basis, and if the child proves that they can be consistent in the chores that you give them, then I think you can be pretty comfortable that they're going to be consistent with their contact lenses.
I was going to say also, sometimes parents will come in and they want their kids to get contacts, and the kids do not. Then that is somebody who should not get contacts. The child has to be ready to make that step too.
One other thing. August, fall sports are starting. Anything that we as parents should be looking for, or how should we try to prepare our older children, especially high school age kids, for the fall sports season? Anything special with eyewear, eye care?
It used to be years ago we had athletic classes. We rarely use those anymore because of the contacts, and whether it's football where there's contact involved, or whether it's cross country or soccer, perspiration. I mean, contacts to me are just the best route to go. And the contacts today, the technology that's used to make them are amazing. And the way you're going to see, the comfort is pretty incredible today with contacts.
So in summary, the end of summer's approaching, school's starting. We should all be looking at that back to school eye exam, whether the kids are young, whether they're junior high, kind of transitioning towards contact lenses, or even the high school age kids. Now's the time to get them in, get their eyes checked so you know where they're at, and everything's kind of tuned up before the school season starts. Everybody will be ready for school and for those extracurricular activities. Dr. Gustafson, thank you for your time. It's been a pleasure.
Thank you.